So we are already networked and plugged in to a larger system. What we see with Portland Street Response is we are partnering with the nonprofits that we are already networking with and using our current platform as a response agency and partnering with them and bringing them on board for Portland Street Response, where we become the first point of contact when it comes to addressing the appropriate need, the appropriate care with the right resource, where we have the time versus an emergency response model. So we see this as a complement. The pilot program is going to start with one team. That's what we were recommending in Fire Management 11's FMA, the Lentz area. The first team will be an EMS specialist, Tremaine, because he already understands the network, the resources. And to pair with a crisis worker was the recommendation, a mental health professional, which we can put out in RFP. The pilot program would run Monday through Friday, 10 to 6 a.m., or excuse me, 10 a.m. to 6 p.m. because we looked at our data as far as the types of calls that met the criteria and the highest peak hours between this time frame. Logistically, we can outfit a van, basically an SUV that we have in reserve. We can also obtain food, water, cold weather clothes, sharps containers. That is what the operation of fire has. Where not only are we able to support Portland Street Response in the pilot, but we can also logistically provide a resource when it comes to vehicle fueling, supply, replenishment, maintenance. The pilot program, Portland Street Response, will have a distinct logo and marking for Portland Street Response. And we also know that the types of calls based on the scenarios are non-emergent, low acuity, or behavioral health, which do not require lights and sirens. We are also, when it comes to looking at training curriculum, working with the Whitebird Clinic. So we're not reinventing the wheel, but they're also, we would use them and contract them in order to create the most appropriate training required to build up the program. And then as far as the services, just reminding everyone, this is a response model that complements a 911 emergency response model. It's within the entire 911 system, where for these low acuity, non-emergency behavioral health calls or informational only calls for fire and police, that we don't need to send a police officer, a firefighter, a fire engine, and 4 firefighters on a houseless and behavioral health low acuity call. This will free up our public safety when it comes to fire response and crime response, so police and fire can respond on higher emergency calls. Thank you.
Thank you.
Good afternoon. We are pleased to be a part of this pilot program, and I want to acknowledge the staff that's participated. They're actually here with me here. Commander Krantz, Captain Lavelle, Lieutenant Hedman, Emily Rashawn, and Stephanie Harrell all participated in the stakeholder group and have given a lot of hours and time, and as well as other officers who've worked in our in the sub-work groups. I understand that Commissioner Hardy's office also had the opportunity to sit down with officers in each precinct who had the opportunity to help inform policy as well. And you also went on a ride-along with Officer Kinney. This program, I won't reiterate what I was already saying in the video, but there are many benefits for us, specifically as it relates to allowing us to redirect our resources to the calls that really truly need a law enforcement officer there. And then I think this also allows us to decrease the likelihood of the unintended consequence that we're all talking about and discussing today of criminalizing those who have not committed a crime. So again, we look forward to participation in the pilot program. Thank you.
Thanks, Chief. Appreciate it. Thanks to your whole team.
Well, I'd like to walk us through a call. I'm Bob Causey, Director of BOEC. And when we talk about different types of calls for service, our 911 center answers 911 as well as non-emergent calls. And we fully expect that these types of calls that would be referred to Portland Street Response would come in on either or. So when the call taker answers 911 or that non-emergency call, they triage whatever is happening. And they assign a police or fire type code depending on the circumstances, based on the nature of the call. Typical call would be a welfare check, potentially a disturbance without weapons, something that isn't violent. It's something that would be appropriate to send an alternate resource. If the call is within the fire management area, FMA 11 as we call it, the dispatcher will then dispatch Portland Street Response, that unit, and relay the call information. If they're available for a call, the dispatcher will send that information via the mobile data terminal on their computer, and they'll be able to pull that call up and respond. If they're not available and there's no other unit available, theoretically they could let that call stack up and respond a little bit later. It just depends on the circumstances in that moment. If they can't respond in a timely manner, the dispatcher will then send the next available, best available responder to that particular call. When the Portland Street Response unit clears that call for service, they'll clear it via that computer terminal, and they will then change the type code from what it was entered as from the call taker to PSR, Portland Street Response, so that we're able to track the data. Some of the recommended scenarios that we're looking at dispatching on would be a person outside needing a welfare check, for example. Those can be described as someone who's down, they're unchecked, the caller doesn't really know their condition. Perhaps they're sleeping, but we don't know. We can certainly send a unit to check their welfare. A person who's behaving erratically, perhaps under the influence of drugs or alcohol. A person who's outside just yelling, but they're not really a threatening individual. A person outside who needs a referral service and they don't have access to a telephone. Or a person outside needing face-to-face mental health check when they can't be transferred themselves to the Multnomah County Crisis Line. Also, potentially a co-response or a mutual aid request from a police officer who's already on scene with an individual and realizes that it's really not appropriate for them to handle. They can call for the Portland Street Response Unit. And also, the Portland Street Response Unit can be self-dispatched if they're not on a call for service and they happen upon a circumstance that fits the criteria. They can let us know and directly report.
Can I ask you a couple of questions,
Yeah.
Bob? First of all, can you gave us a whole list of responses that would be obviously really good for the street response and maybe not the best and highest use of our police officers. Walk us a little more towards the margin. Walk us towards a case that's harder to make that call. How are you going to make the call, for example, if somebody is in crisis and they are potentially, but not necessarily acting out. They're sort of just right on that cusp of street response versus police response. What sort of protocols are you going to design that will help you make a clear decision?
Yeah,
and if you turn out to be wrong in your original assignment, what's the process for backing that up or increasing, if necessary, the police response?
Yeah, we're developing the training right now for our dispatchers, and it's going to take us about 45 days or so to get everyone through the training. But some of the things that we're looking at is whether or not there's a suspicion of violent behavior, or if there's access to weapons. Those are cut and dry. We're not going to send Portland Street Response on that. If they're behaving violently, either physically combative, threatening violence, actually assaulting, we're going to send the police on those calls. It is that middle ground that the pilot program is really designed to test out. And when I had the opportunity to ride with Cahoots, I actually sat in the dispatch center and watched the dispatch operation as they were sending units out. And in some cases, Cahoots would go and they would back away then and ask for the police. Occasionally a police officer would respond, and that's when they would say, you know what, this really isn't appropriate. So it is those middle areas that we need to be able to track the data so that we can further refine what our call answering protocol is going to be.
Very good. Thank you for that. I look forward to seeing where that actually lands. Somebody raised a potential concern with me at some point during this process. I don't even remember who it was or where the concern came from. That as the public becomes more aware that an alternative response that is not a police response necessarily becomes available to the community, what could actually happen is an increase in calls to BOA as opposed to a decrease in calls to BOA. Have you thought about that?
Yeah, this pilot and even a Portland Street Response model is not going to reduce our call volume by any stretch. What it does is provide an added resource for our dispatchers to send, a more appropriate resource.
Thank you, I appreciate it.
Council, we have 2 more speakers, and we hope and expect there'll be lots of questions, but if you could please hold them for just 2 more.
Happy to do it, Tom.
Good afternoon, commissioners and mayor. I'm Kaya Sand. I'm the executive director of Street Roots. And at Street Roots, this is a really big day. I just came from a pizza party because the vendors are celebrating the fact that we got this far. They've been so involved in this the whole way, from really dreaming up the plan, talking to us about these ideas for a long time, being involved in the campaign, being involved in doing surveys of other unhoused people, and even judging the logo contest. So a number of them are here, probably in the balcony because the pizza party went long, and some of our staff are here too. Yeah. So just as a little background on why, on why Street Roots is involved in something like this. For the past 20 years, Street Roots has really been working on issues around criminalization and poverty, because we see every day how the legal system can make poverty more difficult. And this work really is animated, or this perspective has animated our work from the earliest days through our newspaper and our reporting, but also because all of us at Street Roots spend so much time together, and we have about 170 vendors, who about half of whom are unhoused. We all share the same coffee pot, so we share a lot of stories, we share a lot of awareness of each other's lives. And so, you know, we see every day a man digging through the trash in a way that attracts a lot of attention, and it takes a long conversation to realize how he's in distress because he can't see his daughter. You know, we see people that are acting out in ways that are disturbing, and they have back pain, they have sleep deprivation, they've experienced extreme violence. So a lot of this often is about having the time to hear the story beneath the story. And that's something that we really saw through the Cahoots model. Just very briefly, when I did my ride-along, as I know so many folks in the room did, I saw a situation in Eugene where a man was causing a lot of commotion outside of a store, and after Cahoots arrived and was able to attend to a wound, so there was a physical pain that he was experiencing, but also attend to his distress, which was actually that he was missing a cancer treatment appointment and couldn't get there because he didn't have transportation, and they were able to provide that. So that's the kind of thing that we see, that there's stories beneath stories, and often it takes that kind of patience and listening to be able to find out what they are. And so I would say at Street Roots, everyone has a fire inside of them to make this happen, and we are determined. I think the whole community is determined. There's so much will behind you, and you know, we have a lot of pride in the fact that we're sitting here today and that you've taken us this far, because you know, I know at Street Roots, I hear a lot from the community, from business owners, from faith community folks, from grassroots organizers, who all basically say we don't have good options. And there's a lot of people who want to have good options. I had a staff member today who said, can we have Portland Street response already? Because